Good day, everyone, and thank you for joining my presentation today. My name is Dominic Flores, and I'm currently a student at Grand Canyon University. Today, I'll be presenting the dissemination of evidence on electronic medical records, or EMR, implementation. And I'll go ahead and share my screen. The goal of this presentation is to provide information and knowledge for the Evidence-Based Project Proposal, or EBP. This is for the Electronic Medical Records Implementation, or which we call EMR. The goal is to learn about pre and post EMR implementation and to review key factors that influence organizational decisions. The following topics will be discussed. For example, what is electronic medical records, or EMR? The problem description, research support, proposed solution, change model, implementation plan and decisions, PCOT, the cost of the EMR implementation, roles and responsibilities, evaluation of process, and definitely the goals. In recent years, electronic medical records, or EMRs, have rapidly spread in medical institutions, both at home and abroad, bringing great conveniences to healthcare professionals in recording patients' conditions. The goal of this EMR implementation system is to improve the organization's medical record system in order to provide better patient services. This allows healthcare professionals real-time access to patient health information, which we also call PHI. Again, our goal is to improve quality patient care, provide quality medical documentation, provide security, accuracy, efficiency, and also provide system user roles and access. The goal is for the EMR system to provide an efficient process in medical documentation. The PCOT, or the problem description. Our population is the medical records, or the EMR, electronic medical records, user access training, medical paper documentation, EMR implementation versus quality and safety. The PCOT template is a tool that can be used to help formulate a statement that can provide a clear objective for executing the EMR implementation processes. All of these aspects of using the EMR system contribute to the system's proficiency, efficiency, and accuracy. And here is a proposed statement for PCOT. In electronic medical records, what is the effect of user access training on EMR implementation compared with medical paper documentation within quality and safety? So the answers are: to user access, it'll be determined by the business administrators and system administrators, who are also called the RT department. Training will be provided prior to granting access to these users, and users will have specific access to medical documents. To provide quality care to patients, healthcare organizations must understand the efficiency and accuracy of medical documentation. Higher security, training, knowledge, workshops, and IT support are all part of this process. The goal is to improve quality care while reducing time spent on medical documentation so that more time can be spent on patient care. A change model. The Stetler's model would be used to identify a suitable system for the organization during the EMR system implementation. To carry out the project, Stetler's model has 5 phases: planning, validation, comparative, translation, and user experience. The methods of project evaluation. Metrics. Metrics that will lead to improvement will be included in the evaluation plan for the EMR system implementation. To meet specific goals of the implementation, the evaluation of the EMR implementation project will include the following to provide metrics of the system, such as administration, completeness, quality, timelines, system use, and volume of data. Here's a flowchart of the EMR best practices. So we have here the GDPR principles, which is General Data Protection Regulations, that is highly involved with the EMR system processes. In the organization, the EMR implementation process is critical. A Gantt chart provides structure to executing a plan by providing a timeline. Along with providing timelines, we have roles and responsibilities. The RACI model is used to guide team members' responsibilities during the EMR implementation project. So the RACI chart explains who is responsible, who is accountable, who is consulted and informed on the team. Again, the roles and responsibilities of the high-level activities associated with the EMR implementation. The EMR timeline is a critical part of the processes. A valuable tool is using a Gantt chart, again, so to display the task for sub-implementation for each component of the EMR system. I have provided the roles and responsibilities for each department or cross-functional teams that are highly involved. We have the system administrator, the owners, all personnel using, such as, for instance, Aviva Vault Clinical or the medical system, and the system user. Again, with the EBP process, the evaluation of processes is also important. It includes data from local performances, planning, quality, outcome, assessment, and evaluation activities, as well as data collected through the use of the EBP models to assess current practice and measure progress. I hope you enjoyed the presentation today and learned many processes that come along with EMR implementation. Please reach out to me if you have any questions. I'll be here, and you can reach me by email at any time at dflores24@gcu.edu. Thank you for participating in my presentation today, and I hope you learned the processes of the EMR implementation. Thank you.